Thank you, Pam. Thank you, panelists. That was a great conversation, highly enlightening, and you can see by the questions and answers, the responses that you all are getting. You've provoked the right questions, and we'll find the answers out. I'd like to bring on to the dais here, the virtual dais, my compatriot, Dr. Carayon. She will
Thank
give
you.
her reflections, and then I'll give just a couple of things. We have just a couple of things left. Dr. Carayon will give her reflections. I'll say a few words, very few, and then we'll turn it over to the three visionary co-chairs of the Action Collaborative, Dr. Dzau, Dr. Nasca, and Dr. Kirch. So Dr. Carayon.
Thank you, Tim. I'm in the process of sharing a couple of slides here. Let me see. Tim, would you help me and tell me whether we're seeing? Oops, I think we're going too fast.
I see a slide that says mandate for action.
There you go. Yeah. Thank you very much. So I just wanted to share a couple of reflections based on what we heard yesterday and then today. This is just on the fly, some reflections. And so I think one of the things that came true, and this is how we had set up the conversation, is we've been going through really multiple phases. When the report on taking action against clinician burnout came last year, the evidence was pretty overwhelming that burnout was very high among physicians, nurses, and there were indications that burnout was also a major problem for many other healthcare workers. And then suddenly that acute phase of the COVID crisis came up, and then we've seen other factors that have contributed to high burnout, and we've seen then other negative effects on clinicians of anxiety and depression. And then the pandemic is just continuing, so we are kind of entering a phase now where things are piling up. There are all kinds of effects that we're seeing of COVID, of structural racism, of financial challenges, and we've heard about many of those in the last 2 days. We've also heard that it was really important to have some type of organizational structure or strategies already in place, and those were really helpful to support pivot, and I think many of our presenters today use that term of pivot to COVID and figuring out how to deal with COVID, as well as the implications for clinician well-being. But we've also heard that we need to figure out how to sustain our effort. I mean, yesterday we heard the marathon, Ironman, Ironwoman, or the even bigger version of that. And so how do we keep up with that pandemic? And so how do we move forward? And so I think what I've heard, and as probably my biased summary, is really issues of adapting, learning, and improving. Then we need to figure out how to better design systems, and systems have many different elements that interact, and they have levels. And we've heard about all kinds of things that occur at multiple levels of this system, and something that may happen at the external environment is actually felt at the individual level of the clinician. So we need to figure out how to care for our clinician and other healthcare workers, as well as the leaders, at all levels of healthcare organizations. And leadership, I mean, came up in that last poll. Leadership is not just talking, it's action and support, and it's also fostering a culture where we can take action. And then the last point that I wanted to make is really that issue of values that we've heard over and over. Values drive action and decisions. And so some of the important values that we've heard are values of respect, values of wellness, diversity, and compassion. And so that communication and connection are really important. I mean, the other theme that came up a lot is that pivot, that reset. They are really incredible opportunities for us to do things differently. And so I hope that you will continue to join all of us and join the NAM Collaborative on Clinician Wellbeing so that we can continue on that journey. And my final comment is something that Bev brought up yesterday, a quote from Martin Luther King Day: "We may all have come on different ships, but we're in the same boat now." So those are some of my reflections based on what we've heard in the last couple of days and what we've discussed. So Tim, your turn.
Thank you. I am actually going to forego my remarks in the interest of time, but I will say something about thank you and appreciation that Dr. Carayon and I have. This was the work of an extraordinary group of people who put their time and passion and energy into creating this conference. A number of them you have seen in the planning group already as presenters, but some of them you have not. And I'm just going to say the names of the people who have worked hard behind the scenes and did all the hard work. One is Nancy Agee, who is the president and CEO of Carayon Clinic. Amazing input on leadership and some of the things that we talked about. Jalen Benson, a medical student at Harvard Medical School and the founder and director of the National Student Response Network. Again, just amazing. Carol Bernstein, my colleague for a long time on the board of the ACGME, who is the vice chair for faculty development and professor of psychiatry at Albert Einstein College of Medicine and Montefiore Health. Christina Martin, who is the director of New Practitioners Forum, Office of Member Relations, and the American Society of Health System Pharmacists. I'm just using the same superlatives, but I will keep using it. An amazing contributions, worked very hard. And Javed Sakara, who is the Associate Professor of Psychiatry and Pediatrics at the Center for Educational Research and Innovation. The perspectives that these people brought helped shape this thing. And now all those people worked really hard. But the people who worked the hardest and had with countless conversations, ringmastering this whole thing were the National Academy of Medicine staff. I cannot say enough good things about them. And they're Libby Prescott, Samantha Phillips, Jessica Covington, Micheline Torre, and the one who had my phone number and was calling me and I was calling her at hours that were probably scandalous, Tran. So with that, Dr. Dzau, I'm going to turn it over to you and your other co-chairs for your final remarks and reflections.
Well, let me first thank everyone. Then I'd like my co-chairs to speak first, because I already had the opportunity to speak at the beginning of yesterday. Certainly, I say thank you, all of you, Tim and Pascale in particular, for an outstanding meeting. I've been able to attend much of it, missing a little bit here and there, but boy, what an energized discussion, committed individuals, your entire planning group, and the people you name. But I do want to have a shout out to my team. Through Tran, I mean, as you said, I don't know about scandalous phone calls. I don't want to hear about this, Tim, but I know she is the one who's led and put so much time into it. And as you know, during a time of transition. So I just am very grateful to her. Also, Micheline Torre, Samantha Phillips, Jessica Covington, and Libby Pascale. What a team. And you're here today because of their hard work, during time of COVID and during time of transition. It couldn't have happened without their great lead. Of course, it couldn't happen without you and Pascale and all the others. So thank you. Let me turn the floor over to Tom Nasca, and then Darrell Kirch, and I would be happy to come in at the end. Tom?
Well, thank you, Victor. And I just want to extend my appreciation to the staff and the planning committee for this wonderful work, and the speakers who have enriched all of us over the last 2 days. I just have a couple of thoughts that I don't think are necessarily additive, but they may be summative. I think the pandemic has forced us to focus on the intrinsic morality of what we do. I think this has been manifest not only in our altruistic approach to providing patient care in very difficult circumstances, but the almost legendary compassion that's been demonstrated by doctors and nurses and other caregivers providing care in very extreme circumstances, often at risk to their own health and the health of their families. It is not just heroic. It's really the embodiment of altruism, a core professional attribute or value that we all share. I think that one of the other benefits, and I use that word guardedly, but consciously, of this pandemic has exemplified how important interprofessional team-based care is in being successful in providing for the needs of our patients. And this team-based care has spawned a feeling of mutual respect and compassion among the team members. And then finally, the environment that we live in and the disparities that have been unearthed and brought to tremendous visibility for all to see during the pandemic has heightened our concentration on justice. What do we need to do to ameliorate these dramatic disparities that we're seeing in society and focused on in the pandemic? And I think Brian Adib's conceptual framework of bringing these issues into value statements in our institutions is an important part of the solution, because values should drive institutional decision-making. If we have values of well-being, not only of our staff, but of our patients, diversity, equity, and inclusion as a core value of an institution, empathy and compassion as a core value of our institutions, mutual respect as part of our institutional values, along with stewardship and all the other practical dimensions of values that we need to introduce, the resources will be there even in tight times to achieve the goals that we have that are values-based. And I think that the refocusing of our moral mission, that of providing to others, care to others, has invigorated the profession as much as it has challenged it. I think we have the opportunity to make something even better coming out of the other side of COVID, based on the return to our core values. And if we can link them to our institutional value statements, we can change the culture over time. This may be the vehicle to change the culture that we've been looking for and searching for over these last few years. And once again, I want to thank the staff and you, Victor, for the willingness at the National Academy to take these issues on. 5 years ago, this was not a popular topic, but you recognize the need of the nation, the need of all of our caregivers, and you provided us the opportunity to really try to make a difference that will be lasting and culture changing.
Thank you, Tom, for those really inspiring and moving words. Your leadership is truly appreciated. I can tell you that, first of all, this would not have happened without you and Darrell, and certainly by getting us all energized and involved with this issue. and certainly won't have happened without your continuing support, guidance, and leadership. So thank you. May I turn the floor over to Darrell, please? Is Darrell with us? I think not, as I see the people on my gallery.
I think I'm unmuted now. I'm
okay.
only able to join. I'm only able to join by audio, and I apologize for that. I thank Tom for just some wonderfully eloquent remarks that he just made. And I thank Victor. You know, Victor was making tough decisions a year ago for the National Academy in terms of what would have to be put on the back burner in the face of the COVID pandemic. And to his credit, he realized that this collaborative and the work on clinician well-being could not afford to be put on the back burner. If anything, it was going to become a more acute issue, and it has. I think the presentations over the last 2 days have highlighted the importance of this work. And I know for me personally, and I hope for all the other members of the collaborative, it's going to re-energize us around increasing our efforts in the months and years to come. I do have some fear that as the pandemic hopefully comes under control and people understandably want to return to whatever their new normal is, that we'll lose some of the highlighted focus on well-being that exists now with the stresses the pandemic has placed on our colleagues. We can't afford to lose that. This issue is too important to allow us to lose any momentum. So I personally am more committed than ever. I also was gratified to click on the participants icon and at times see that we had more than 300 participants, which is wonderful. And I know that the sessions are being recorded and will be made available. And I know the staff will follow up perhaps with a more specific answer to how some of the questions that could not be addressed in the panels might be addressed by the collaborative. But my thanks to all of you, and Victor, back to you.
Thank you. So this really ends this webinar, but certainly not end this great effort that everybody's put together. I would say that using Tom and your words, this meeting's been energizing. I think Tom's words is reinvigorating. And certainly for me, your commitment, your passion to care for patients, to care for each other, affirms the reason that all of us are in health and healthcare. It's about the caring. It's about everybody. And so, as you said, Darrell, COVID is a stress test, and we failed. We knew that our system was not doing that well. We were not that healthy. We needed more to be more fit, more resources. But when we need a surge during stress tests, and we can see that we're not as prepared. We didn't have as much resources, and the fundamental system is not working, certainly not working well enough. So as Pascale and Tim have repeatedly said, it really underscores the issue of making sure we're a healthy system and that we can respond, if not at least take care of and prepare for the challenges we face ahead. So I'm just energized. The good news is that because of the great commitment of all of you, I know our future is bright. And as you said, we are committed to continue this journey with you. And very soon we'll have the members discussion where we begin to talk about our future. But I would say our future is bright, and our future is bright because of all of you. So thank you very much. And this, I think, marks the end of our open meeting webinar.